I'm Dr. Allan Perel, and this is Conversations in Medicine. This is Conversations in Medicine. I'm Dr. Allan Perel, your host. Thank you for watching us here tonight. We usually talk about very controversial areas and educational areas in medicine. And really there's nothing more controversial and more interesting than talk about today than vaping. It's on the news. You see it on every radio station, every TV station. We talk about it, the dangers of vaping, what it's doing to our community. And we're going to go through some of the myths, some of the facts, and try to get some of the real information out to you by experts who know about this. My wonderful guest here, and I want to thank everyone for coming in here. Right next to me is Nancy Sayegh-Rooney. She's a lung nurse navigator. Thank you for coming.
Thank you for having me.
Dr. Keith Diaz, who's the Director of Lung Cancer Screening and the Director of Pulmonary Rehabilitation Therapy at Richmond University Medical Center. Thank you, and a good friend. And Dr. Jay Fenoyim, another very good friend, who's the Vice Chairman of the Department of Medicine, Program Director of the Internal Medicine Residency Program, and Chief of Critical Care. So it's a pleasure for me and hopefully for our audience to learn a lot about vaping with three real wonderful experts. So thank you for coming.
Thank you.
So now we're going to get really started. As a neurologist, vaping is something that I read about, I see about, we talk about on TV, and I hear at meetings. And I see different edicts from the state, from the governor, and really don't have a great feel for it. I mean, I want to learn from you. So Nancy, if we could start, what is vaping?
Vaping is an aerosol mist that they use a mechanical device basically, right? And it's different than a cigarette. It's not a combustible cigarette, but it still delivers nicotine. And the kids are all using it. They're marketing it to the kids. So I'm a certified tobacco trained specialist, and I run tobacco programs, and I saw that there was a need for not only for the lung screening patients to learn about tobacco and tobacco cessation, I saw there was a need for that there was a teenage epidemic happening. And I started investigating, and I started collaborating with the schools and going to the schools and speaking to the teenagers and finding out what exactly do they already know and who is vaping and who's juuling. And so they have a whole different language that us as parents, as healthcare workers don't even know about. Like they call it a rip. It's not a drag as we used to think. So there's a whole world of this new generation that are using these products, and they're marketing it to these kids. And they're flavored with Cinnamon Toast Crunch, bubblegum, cotton candy, just everything that a kid would want and think that it's okay. And then they have this idea that it's nothing but sugar water, and that's not true. So when I go into the schools, I usually ask them in the beginning, what do you know? And they all raise their hand and they tell me what they know, and they say, well, how do you get this? If you're not 18, how do you buy this? And they go, oh, well, we asked so-and-so's brother to get it, or we can get it online. I'm like, and there's been times when the parents are in the back of the room and they're just blown away because they didn't even know anything about this. So one of the biggest things is that they think that that pod from the Juul is equivalent to a pack of cigarettes, when it's actually, there are different levels.
You mean the amount of nicotine?
The amount of nicotine, there's 20 milligrams of nicotine in a pack of cigarettes, depending on the drag. So if a normal person drags a regular cigarette, they're going to get 1 milligram of nicotine. So if you smoke a pack, that's where the patch comes in at 21 milligrams. But in a pod, it's 60 milligrams of nicotine. And some of these kids are smoking a pod a day.
So let me ask you, Keith, because again, we're going to go back to some of this. What's the difference between smoking and vaping?
Well, smoking is actually using, fire or some heat source in order to ignite or combust tobacco or other types of dried products, and this creates smoke, which we think of as something we can see through or something that is floating in the air, but it actually is made up of very small particles. And those particles, when they're smoked and inhaled, can deposit in the lung. It causes inflammation, which can lead to damage within the airways and the lungs themselves. So vaping is using some type of heat element, and it usually has a battery and some type of an electric device, and they are used to ignite a liquid compound, and these compounds are made up of some type of chemical that is flammable, so that most of them have propylene glycol, glycerol, and then they have other types of products, whether it be nicotine or flavored compounds, and then these are turned into a water-type vapor, and then they're inhaled into the lung. So again, you're actually inhaling these type of particles. They're foreign to the body. It can cause a lot of the similar type reactions of inflammation and irritation, and the products that are put in there actually have been shown to have breakdown into carcinogens, so they are known to actually cause cancer as well.
So the products, so what's being vaped are actually pro-cancerous or carcinogenic products.
Correct.
And it's possible that they could lead to cancer years from now.
Correct.
Jay, you were talking to me before about how many people vape. And any idea, I mean, you would tell me some numbers, I think you told me 9% of the 300 million people and 300 plus million people. So tell us a little bit.
Yeah, 2018, at least the data at that point, we had about 9% of the population vaping. And just to follow through what Nancy was talking about earlier, 1 in 4 teenagers vapes. At least 1 in 4. So it's a big percentage of, if you look at the numbers, there's quite a lot of people vape.
So it's something that's very common. It's a public health issue.
It's a public health issue, and besides what Dr. Diaz mentioned, it makes it's difficult for us as physicians, especially now that you're having the flu season and everything. These individuals come in, then you're trying to figure out whether their symptoms are from vaping or from flu. I mean, it's a public health issue.
While I have you, and we're going to go over some things in a little bit. One of the things that we see about in the newspaper and in the media are the people who've died from vaping. And the idea there were 30 plus, 35 people in the United States who've died from vaping. As the head of the intensive care unit at Richmond University Medical Center, the critical care areas, and again, we have pulmonologists, and you round also, you're in the critical care units. What are they dying of?
They usually die of the injury to the lung. As a matter of fact, the definition came out about 2 weeks ago, where the EVALI, basically e-cigarette, e-vaping product, acute lung injury. And basically, the way I see it is like the acute lung injury that we've been treating in the past. Just get injury to your lung, and can't exchange oxygen well. Some of these individuals end up on ventilators. If we look at the number of people who've died, about 35 to 37 so far in the country. Some of those individuals ended up in the ICUs on ventilators. And that was especially so for patients who are usually above more than 50 years of age.
Above 50 years of age? Because I know we've been talking about young people having this, but the people who actually have some of the medical conditions that you said are older, which is interesting, which is something that I didn't know. And the treatment for people like this, I mean, you said there was one case, I think, at Richmond University on Staten Island.
Yes, I'll let Dr. Diaz comment on that
please.
case, but as far as the treatment is concerned, while nobody knows how it works, most of the patients who had EVALI, who received steroids, did better. About 82% of those patients did well when they received steroids.
So the anti-inflammatory medicine helped whatever the inflammatory process that's occurring.
Right.
So tell us a little bit about Keith. What about the patient on Staten Island, what you've seen with regard to this?
We did recently have one patient admitted to the hospital. He was, I believe, in his mid-30s using a vaporizer, and he was actually vaping a THC or marijuana derivative type product that he was buying, I believe, off the street, not knowing the manufacturer or anything like that. And he essentially developed ARDS, which is acute respiratory distress syndrome. He did not go into the intensive care unit because there are levels of that, and his was on the more mild type. He was placed on steroids, and he did improve, fairly quickly, luckily for him.
Interesting and sad to hear. Let's talk. I see Nancy brought some wonderful literature, and she has something called the vaping quiz. And for someone who's just heard about this through some of the rounds I go to, grand rounds, listening to it, the idea that my education, even as a physician, is not really up there. And I'm sure our wonderful audience who's out there really is interested in knowing things. So when you go to the middle school, high school, teenagers, and you give them this vaping quiz, and you're going to, if we can answer some of the questions, maybe we can all learn a little bit more about vaping, and then we'll talk about really the evils of it, and whether, and maybe the question I'll ask even right now, could the respiratory, the ARDS or the valley syndrome that you talked about, could that happen to anyone? Or is there something where, is anyone immune if you're 20 years old and say I'm in good health otherwise, does that mean it won't happen to you, or it really doesn't have any, you don't know?
Unfortunately, we don't know. We believe it probably could happen to just about anyone. We're not exactly sure why it's occurring. They've linked a lot of the events to people who were using it for THC type products, but it's also
THC is what? So
THC is tetrahydrocannabinol. It's a marijuana derivative. It's the active ingredient in marijuana that actually gives you that euphoric or high type feeling. So it's popular on, on the black market, if you will, or on the street, but it's also used in medicinal ways. People can use this product for people with cancer or advanced disease.
medical marijuana, one of the ways to do it is through vaping.
Correct. But unfortunately, some people are buying it maybe in not such regulated areas, and those might, they might be subject to contamination of the products that they're buying, and we just don't know.
And I'll ask you a question that I didn't even think about till this moment. If they use regulated over-the-counter, that whatever guidelines that are there, and the word Juul, the actual brand itself, does that mean their risk is nothing, is down to zero, or is that, we don't know?
It's less likely, but the risk is still there.
The risk is still there.
The risk is still there.
Nancy, let's jump into our vaping quiz. So
Well,
we'll see what
the
we can
reason that I do the vaping quiz is so the kids know what the truth is. Because they're marketing these flavors to these kids, and I mean, adults don't want blueberry. I mean, adults aren't looking for cotton candy, so we know that these kids are enticed by that, okay? And then as soon as they get the nicotine addiction, I mean, I know and you know that nicotine addiction happens within 7 seconds. It gets to the brain within 7 seconds. And once that memory receptor gets it, it's there, it's an imprint. So I talk to them about that how it stays there for the rest of their lives, that first euphoric feeling with the dopamine release. And it's really interesting because the kids have no idea.
Really?
And like I was saying about the brain, I talk to them initially and I say, okay, so you're 12 years old. Are you the height that you're going to be when you're 20? And they go, oh no, I'm going to get big. Okay, so your body's still developing. So you're putting something into your body that's taking away oxygen and that's affecting your brain, and your brain is still developing. And so then they look at me like, what do you mean? This is going to hurt me? And it's a whole cycle. So what I do is I pass this out and I have them read it along with me. And one of the first questions is true or false. The vapor is just water. So as you said before, it's not just water. So they all think it's just sugar and water, and they have no idea. Then one of the other questions is about the nicotine. And
Let's just read them one at a time. I think
Okay.
it's such a wonderful thing you showed me.
So true or false? The first question is, the vape is just water.
And we know the answer is false.
Right.
There are a lot of chemicals in there, things that can cause cancer. So it's not a benign sugar water that you're taking.
The next question would be, which is following is true about nicotine? Is nicotine a drug? Is it an addictive drug? A. B. Does it affect your heart, your blood vessels, your brain development? C. Is nicotine safe? D. Is liquid nicotine poisonous if you swallow it or absorb it through the skin? And so then they like, poisonous. And we know they're all true, right? Which liquid used in vapes can contain, what liquids used in vapes, what's contained in the vape? And so you had told us, what's in there?
Depending on the substance, especially the flavors, have a lot of different chemicals that I think have not been regulated at all. So some of those compounds, we have no idea what the breakdown is going to be, but in general, just to have them flammable, we know that they're definitely breakdown compounds that are carcinogenic and also causing, these inflammation type responses in our bodies. So.
And so when these kids read this and they find out formaldehyde, then I have to explain to them what is formaldehyde, what is a carcinogenic, what is paint stripper. So sometimes I not only just bring this, I bring the products and I place it in front and I ask them, would you ever put this in your mouth? Would you ever want to eat this? And they just look at me and they go, no. I go, well, that's what you're doing. And so it just like gives them a
When I was a kid,
a
with
visual.
cigarette smoking, there's always the tar content.
yes.
You think about tar, I remember someone in my school bringing in a can of tar.
I bring that too.
And Sam, okay, and Nancy, you're on top of it. So the tar actually, who would put that in their mouth?
Yeah.
Of course.
Well, the ammonia is the big thing, but
Yeah.
that's what I talk to them about cigarette smoking. But I believe that this is like a back door to get them hooked on nicotine. And once they can't afford to buy the stuff in the vape shop, what are they going to do?
It's much more. How much is
A Juul?
Yeah.
Is $50, the starter kit. $50. And then each one of those pods is $9.99.
It's a very expensive habit.
Yeah.
I think about 30% of kids who have picked up e-cigarettes are more likely to have started regular smoking as well, isn't that? Yeah.
And then one of the questions is, vaping can lead to which of these health issues? Asthma, popcorn lung, and they all know about that. And I have to explain to them.
Tell us what popcorn lung is for people
I'll
who
let
don't
the
know.
So popcorn lung is something that had been in the news a while back, where people were coming down with this disease of ARDS, and they were working in a microwave popcorn factory. And one of the things that they use to flavor the popcorn is diacetyl, which can be harmful and cause that type of response. So they were getting large inhalation doses of this and then going into this massive lung injury. And it's been found to be present in different types of flavors, not just butter flavors, but I think 4 or 5 different flavors that they're using in these vape juices, as they call them.
Vape juice, e-juice.
And that can cause severe lung
Yeah,
disease.
absolutely.
Yeah.
Are these always reversible?
No, absolutely not.
No.
Many times they can, be progressive and cause even permanent scarring. And as we've heard in the news, there have been 30 recorded deaths associated with this. So,
What's our next question?
Vaping helps people quit smoking, true or false?
there's been nothing shown to say that really this is going to be a safe alternative to cigarette smoking.
So there are two evils. I mean, clearly we know from the Surgeon General in 1964 that smoking is bad. And you run a lung cancer prevention center at the hospital. I mean, we see the ravages of that, and we watch the television commercials about smoking and the public service commercials. So smoking, we know, is not good. Whether we could compare the two, and after listening to you for a while before, we're getting some expert opinions, they're both bad. Which is worse is hard to say, but at least we know they're both bad. And vaping, if, as you said, 30% of people who vape will go on. And Nancy's basically telling us that the biggest thing is to prevent youngsters from doing this.
I don't want them to be part of my lung screening in 30 years from now.
Right.
So by educating them now and having that conversation, because I think our generation stopped talking about it because we were so anti-smoking that we thought it was okay and nobody was smoking again. But then all these vape shops show up. And right?
I was going to say, I think one of the important things, he mentioned the high incidence, it's 1 in 4 teenagers, but what we've also seen is this has grown since, the last 5 years exponentially, by, 20, 30% per year or something like that. So it's really just has such a huge momentum that it's become so popular amongst so many
As you
people.
mentioned, in New York State, they're basically banning flavored vapes. Do you think that's going to lower the usage?
For the kids. For the kids, to entice the kids, I think it's going to change their wanting to try that, because there's that sweetness isn't going to be there. Cotton candy isn't going to be there. But I think that what's happening too is that because of this aerosol, the parents don't smell it. It isn't the smell of tobacco, which we know is second and third hand smoke. We know that smell. So the schools now have monitors outside the bathrooms because the kids are all going in there vaping. And so even I believe Perel has a special device that could pick up that aerosol and alarm them that the kids are in there vaping.
That's one of the local high schools here on Staten Island, yes.
So it's something that, like, you can't, the parents don't even know about it. They put it in their sleeve like a pen, and some of them are so small. I mean, we know what the jewel looks like. Then there's other ones that look like little pods, little itty bitty egg pods, and they just put it in their sleeve and they go like that, and they get a rip. It's not a drag, it's a rip.
So they get that nicotine
They get their
fix.
nicotine hit.
Is there any secondhand exposure issues with this, or we just don't know yet?
We don't know. There definitely will be, because that smoke or the vapor is exhaled, and then that just gets inhaled by someone else, just as regular secondhand smoke would. It's difficult to quantify how much and what concentrations that is, for other people, but it's definitely
But it's
a
not
risk.
good.
No, exactly.
Any other questions we have?
Vape companies use which tricks to get young people hooked on vapes? Flavored nicotine, ads that make vaping look cool, trendy looking vapes, all of the above. So we know that. And so what I do talk to the kids about is that vaping is a wolf in sheep's clothing. And I try to explain to them that they're marketing to you and they're trying to get you hooked, and they don't really care about your health. They just care about making money and your money.
So if a parent wants to learn about vaping, other than watching the show here and seeing all of us talking about it, is there literature? Is there
Yes.
a website?
There's literature. I go to PTA meetings.
But how would someone get it? I mean, there's a way, of course, to contact you.
Yes.
And your name is going to be up there. But is there any other way that people could find out about it? Is there any website? Is there any?
Yes,
Tell us about it.
New York Health quits, 1-800-QUITS or Quit Now. There's our public health websites that everybody's on it. American Lung, American Cancer Society. So if you go on to any of those websites, you're going to get information about it.
Are there programs to get people to be able to stop vaping? I mean, we talk about medicines like Chantix or nicotine patches from the city for people who smoke. If someone is vaping and their parents say they want to get this youngster or even an adult wants to stop vaping, is there some program for them?
So it's the same type of tobacco cessation program. I do have a vapor coming to my tobacco classes, and so the only difference is when we do the carbon monoxide test, he does not have a high level of carbon monoxide, where the cigarette smokers do. But it's a nicotine dependency, and he still has something in his hand. And for a normal smoker of a pack a day, they spend about 2.5 hours holding something. So you have to work on not only the mental part of the brain, but the physiological part and the psychological part. This is their best friend. They have a nicotine addiction, and that's what we have to really work on.
And as you said, the earlier you become addicted, the earlier you're exposed, the more likely you're going to have a problem with it. I think you asked me some neurological questions about the brain. The brain doesn't mature until you're about 20 or 22. There's certain coatings of the brain called myelin that really comes aboard. And that's why teenagers are somewhat impulsive. as the parent of a couple, I sort of know. They're very impulsive. They've got a lot of ideas. There's a whole theory. That's why people go to the military sometimes in their teens, because they feel very empowered at that time. And then over time, we sort of get a little bit more inhibition by this, and that's where sometimes it helps things later on. But the idea that using a medicine, being exposed to nicotine early on, or any drug, yes, we'll have a much higher incidence of addiction later on.
Yeah, there's evidence out there that vaping increases the likelihood that these kids will have mood disorders, become more aggressive, as well as it's not just it's not just the brain development, but when as teenagers, when they take it, they become more impulsive. They could get into accidents, fights and stuff very easily.
So if you could speak to the legislators, I'll have Nancy said a little bit. I'll let Keith go first, and then you, Dan, will go around because we're coming towards the end of our show. Do you believe that what our public officials are doing, and we'll talk about New York, we're in New York State now, are doing enough? And what would your goal be? Would it be to ban vaping of all kind? Would it be, and I'm giving you sort of suggestions of where I'm going with this, would it be to regulate it more? What do you think as physicians in the lung field, as a nurse navigator, lung navigator in this process, to really tell us what would be your goal as people in the trenches? So maybe we'll start with Keith.
I don't think they're doing enough. They started this process of looking at it in 2009, and some of those laws were actually delayed, and now they have placed some regulations where the manufacturers have to come up with, or apply for apply for their product, and that was delayed to 2022, whereas it was supposed to have taken effect already, and I think that delaying that is not a good thing. I think that by regulating it, possibly, and trying to find out, maybe how to make the product safe, could be some type of alternative to smoking. But I think that regardless of that, it's still going to be still going to be a bad product, a bad thing to do. It's going to be harmful.
What do you think, Dr. Perel?
I look at it a little bit differently, because I think the legislatures are doing the best they can. There's always public opinion out there. They also have they have to take into consideration the number of people who are employed in this industry, which is a lot of people. So all those things have to take into consideration. And then the other thing is they really need to have the evidence available for them to really make informed decisions. I am not for abolition to take it off completely, and the reason I'm not, if you look at the use of since vaping came to common use, the rate of cigarette smoking, combustible cigarette, is reduced by at least 14%. It's reduced by at least 14%. And I personally think what they're doing right now is the flavors that have been added have been found to be responsible for most of the issues. So that's what they're working on right now. I don't think anybody should be using nicotine. But if you took that off the market completely, you're going to get people who
We're finishing up. I want to say thank you. And Nancy, I know your opinion after what you said about the United Schools. Thank you for educating us about this.
Thank you.
And thank you so much for being our guest.